Ethical and legal decisions for end-of-life care can be confusing and daunting for a lot of people. Join us as we take a look at a few of the issues that may concern people in this time of need at their end of life. As a nurse, you are constantly put in different situations and will face challenges that will evoke an emotional response. It is important to remember that keeping the patient's needs in mind is always a priority, even when there are ethical dilemmas. A patient's right to autonomy is the right to make their own healthcare decisions. This can be in the form of an advance directive, living will, or putting a DNR order in place. A patient also has a right to assign a healthcare surrogate to make decisions for them in the event they are unable to. So what happens when a patient and family loses autonomy and are forced to make an ethical decision because of limited options? Florida is one of many states where physician-assisted suicide is illegal for terminally ill patients. In 2023, a patient and spouse made a pact that she would end his life and commit suicide due to terminal illness. Would they have made this decision if physician-assisted suicide was legal? This is one example of an ethical dilemma a patient faces at the end of life. So what other ethical issues affect patient care? Moral distress can become apparent when healthcare workers encounter legal and ethical issues, such as palliative sedation, mechanical ventilation, resuscitation without a DNR, and physician-assisted suicide. The difficulty with palliative sedation is that it prevents the patient from changing their decision. One may ask, how does one judge the effectiveness of a treatment for a subjective symptom when the person experiencing it can no longer communicate? Mechanical ventilation is another ethical dilemma that a family or physician may face. The decision to use mechanical ventilation is based on quality of life and withholding and withdrawing life-prolonging treatment. What would the patient want? The question and dilemma with resuscitation without a DNR form is if the patient is suffering from a terminal illness, can their family make the decision to prolong their life if the patient themselves are unable to? So what is a living will? A living will is a legal document that states your medical preferences in the event you are unable to. It allows you to make your own decisions and reduces the confusion of determining your preferences in a difficult situation. A do not resuscitate and do not intubate order does not require an advance directive. A patient needs to communicate that he or she wants a DNR or DNI, and the doctor can add the request to the medical record. It is helpful to do this with any new admission. A patient has the right to assign a healthcare surrogate. However, this leaves the final decision up to this individual. It's important to designate someone who will honor your wishes. If you do not have a directive or surrogate, the final decision may be made by your next of kin. As a family member, would you be able to abide by the patient's wishes? It's difficult to say unless you have been in this situation. Feelings of guilt and fear of making the wrong decision can take over, which is why it is advised that the patient have an advance directive in place. Sometimes patients suffering from a painful and terminal illness decide that death is preferable to life. Physician-assisted suicide allows a terminally ill patient without possibility of recovery to actively shorten their life with the assistance of a physician. Physician-assisted suicide requires a prescription of lethal medication to be self-administered, whereas euthanasia is when a patient's death is deliberately caused at the hands of the physician. There are multiple types of euthanasia in regards to how the decision is made. Passive euthanasia is when efforts to extend life are terminated and the patient dies naturally. One example would be hospice care. Active euthanasia is caused by doctor intervention. All euthanasia must be voluntary, with the exception of when the patient is in a vegetative state. Oregon was the first state to legalize physician-assisted suicide following the Supreme Court ruling in 1997. It is now legal in 11 states. Not all states require residency to administer lethal medications. However, all states require a terminal illness. States that require physician-assisted suicide require a minimum age of 18 and a terminal illness diagnosis. The patient must be competent and it must be a voluntary decision. The patient is required to make 2 independent requests before assistance is provided. According to the AMA, physician-assisted suicide is fundamentally inconsistent with the doctor's role. A PAS request signifies a patient's end-of-life needs are unmet and further efforts are needed to educate providers. Looking back at the case study, would the outcome be different had physician-assisted suicide been an option? The difficult decision of having to take her husband's life and the legal ramifications occurring may have been avoided. Regardless, it's an ethical dilemma in either circumstance.